UNC's Consultation-Liaison Psychiatry Fellowship is a one-year ACGME-accredited fellowship in advanced psychiatry, focusing on psychiatry and the medically ill. I think what sets this area apart is the beautiful weather, the great culture, having Chapel Hill, Durham, Raleigh, all within accessible range, each with their own individual flavor, and just a really collegial and engaging environment.
The one-year fellowship in CL Psychiatry should be something of a finishing school. Everyone is a fully trained psychiatrist. Most people know how to do consults by the time they're done with their residency. We wanted to take it to the next level and really help people develop a level of expertise and comfort so that they were really quite good at what they do.
When people come into the fellowship, some people really know what they wanted to do. There are a lot of people that come in and they don't know at all what they want to do. UNC is great in the sense of there's so many different populations that we work with, and fellows get exposed to those in clinics and on the inpatient service. So sickle cell clinic, cystic fibrosis, transplant, burns, women's mood, our psycho-oncology clinic. There's just so many opportunities for people to get involved and see what they like.
Depending on what your interest is, you can really learn as much as you possibly can and go deep in an area of specialty with someone who's been doing that work for a long time and really knows that area inside and out. We wanted to make it focused on a coaching model. We've got some really highly specialized people. We've got, I think, some of the best burn psychiatrists on the planet. We have psycho-oncologists who spend most of their time in the cancer hospital. We have experts in ICU psychiatry. We have experts in solid organ transplantation.
2 months into the fellowship, you switch from doing direct consults to overseeing consults. So you become kind of the acting attending when you're on service. As the fellow kind of in this new role, you're getting your feet wet. Towards the end of your fellowship, you don't even want the attending in the room with you. You feel super comfortable. As much autonomy as a fellow wants, like towards the end, is something that they can have.
Our CL service covers 2 main hospitals. There's our 900 plus bed UNC main campus here in Chapel Hill, where we see folks in person. We're also expanding to add a new surgical tower, as well as our community setting in Hillsborough, North Carolina. It's a 120 bed community hospital that we cover through virtual consults. We see over 1,700 new consults and over 5,000 follow-up consults a year. We see folks, regardless of insurance status, from across the state of North Carolina. We see professors from down the street and folks that have never engaged in mental health treatment from beyond the mountains or the coast, and everybody in between.
We have a very interesting patient population. This is a large, busy, complex medical center. You can kind of do anything you want here.
It is geared towards making sure every fellow is successful at what they specifically want to do. When you leave UNC, you are able to do this job and do it really well.
At no other time are folks going to be as interested and engaged and committed to your success and your improvement than during this year.
I think we've got one of the most amazing collection of CL psychiatrists that you'll find anywhere on the planet. These are kind people, these are smart people, they're hardworking, they're good to each other. It's a joy to do the work because it's hard work, but you're doing it with really great folks.